Sure. So my name is Kelly Hale, but I'm really quite often known as Kelly Kale. And of course, there's a story behind that.
Okay.
The name of my business is Inspired Wellness, and I'm outside of Detroit, Michigan. And I have a holistic wellness practice that combines Pilates, occupational therapy, brain gym, and manual therapies. And I'm so grateful to do what I love. I just want that for everybody. And I know most of us in this profession feel this way.
Hmm.
And I'm really grateful that I can continue to serve and work during this really unusual time. We never ever thought we'd be in a time like this. And I'm just grateful I can continue to do what I love in a creative way, of course, in a safe way,
Yes.
but I'm every day grateful for that.
Nice. Very cool. So yes, and going back to your husband and his work and then giving space for that, I feel like that's something that I recognize. We're advocates for many things and we're activists in many different ways. And as much as I love talking Pilates and men doing Pilates, I'm also normalizing the conversation for men being dads and the struggles that go with that. Because, like you said, women speak to that and new moms speak to that and I almost feel like there's no airtime for dads who might be struggling because we're just supposed to man up and deal with it or not really care about it or just make your money and provide for your home. Whatever messages we've heard over the years, when we have these conversations, it normalizes that, okay, well, it's not just a mom on a Zoom call who'd expect a kid to bust in and ask a question. Like a dad on a Zoom call for work can have a kid bust in and ask him a question too because he has a relationship with his kids.
Right.
Like
Absolutely.
that's huge.
It's huge. And I've been thinking a lot about that because my husband traveled a lot for work before this, and now he's trapped in his little office upstairs, a bedroom converted to. And it's really hard because he loves being with people, but he's figuring out ways to engage. And again, super grateful that he works for such a progressive company because they're finding ways to support. They've given extra time off for COVID stress,
Hmm.
or if someone has to help care for ill family members, or like we're talking about, we're very fortunate in that our daughter goes to a school that's out in the wilderness. It's a very European kind of wilderness school. She's outside in masks, in MASH style tents. So
Amazing.
she's still going to school, but we could get pulled back at any moment.
Right.
And so he and I are talking about, okay, well, maybe I could see people from like 6:30 a.m. until noon and take over the virtual schooling support. And then maybe he could, in the morning see his clients. And so we're trying to be creative. And his company, thank goodness, is super supportive of that. And they even, I was laughing because I've been telling him his backdrop's really boring. It's just like a painted wall. And they recently had a meeting where they brought in some consultants to help the team members that are leading meetings on Zoom do a little zhuzhing up of their background to make it a little bit, um, and just a little bit more conducive to inviting
Yes.
people into the Zoom setting. And so
Right.
I just love doing things like that. And yeah, I mean, dads need support, as do women. Juggling, especially, again, my husband is an amazing daughter. That's why I finally went on a date with him because I saw how he interacted with children.
Yes.
And he's an amazing father to our daughter. And he is just always right there, whether it's getting his nails painted or helping with homework
Yes.
or playing dress up, playing board games. I mean, I'm grateful for that. And yet I know that he gets tired and he tells me, he's like, I just need to tap out. I've been dealing with, preteen drama for a while. Can you take over? And I'm like,
Yes.
yes, I will step in. So it's a good partnership and I'm grateful for that. But I love, love, love that you're helping men even just acknowledge and vocalize that so they feel seen and heard around those challenges.
Thank you. And that sounds like your space in general, whether it's with in the Pilates space or occupational therapy, like how are we taking care of ourselves?
Yes. Yes, I love the whole idea of self-care, and you'll see on Instagram, for example, Self-Care Sunday, which is great.
Hmm.
But I'm here to say Sunday is not the only day to think about caring for yourself. And realistically, that might be the only day that you can fit it in. But
Hmm.
I would challenge you and encourage you to say, what if you did 2 minutes during your day? For example, I teach this technique and it's called hand washing in the middle of the forest or in the middle of the woods. And it's
Okay.
analogy for washing your hands. And it's part of the whole inner resources program. But it's really saying, okay, for the busy practitioners, if you're in a clinic setting or a studio setting, we're washing our hands even pre-COVID. So that might be the only moment between clients or patients that you can go in and have a little time to yourself. So how can you make the ritual of hand washing that you already do, how can you make that something that realigns your nervous system, helps you deal with toxicity, and just find your grounded sense of space? And
Yeah.
so I like to say that's not on Sunday, that's in the middle between each and every client, so
Yes.
that you can think about little ways to sprinkle it through your day, because
Mhm.
that's what our nervous systems really need. And let's say that you are on Zoom, you're still washing your hands a lot because of this time with COVID, but maybe between Zoom clients, stepping away from the screen and doing something for your eye health, because your eye health is really tied into your nervous system and your movement health. And
Right.
so what if you could get away from that screen and even just take a moment to look far out into nature and then look close in. And so doing the far to near is really important because we lock our eyes down on the screen, and that's a situation where we're going to get stuck. We're
Yes.
going to pick up some of our reflexes that
Mhm.
were previously working really well in the background for us. And so getting those eye
Good thought.
movements, even
Yeah.
breathing them into Pilates, is really, really important.
Yeah, I haven't done enough research on that. I know Joseph Pilates did talk about eye exercises and all this. Do you know anything about that?
Yes, I have. Well, I don't know a lot about how Joseph approached eye movements with Pilates, but I have a lot of layering of eye movements. I've done a lot of studies on eye health and how it affects the nervous system.
Okay.
And again, if you're on the screen, you're locked down, right? So we need to, it's as simple as stepping away from your screen, pushing away or folding down your screen, and just take your eyes horizontally side to side, scanning, or take them in circles or vertically up and down. And then for all the Pilates, yoga, movement practitioners out there, go ahead and layer some of that into the movements that you do. You have
Mhm.
your client on the reformer and you're doing footwork. Well, there you go. There's a great chance to have them on the reformer. They're doing a very vertical movement, right? Let's
Mhm.
add in some horizontal eye scanning. Start to notice where it's difficult for them, because if you really pause and notice, you're going to see people don't have always very clear and smooth tracking. And so then
Yes.
maybe you add in some diagonals and just start playing around with that. I mean, there's all sorts of exercises I do that have a visual component,
Very cool.
um, that are really going to help integrate that nervous system. And sometimes it's the best way to bring a quick calm to someone because they're in
Mhm.
that scattered, stressed out, anxious state. Eyes are really, really big with anxiety. So I do a lot of work with the eyes for anxiety.
Very interesting. And just, being kind of a movement, nerd, I look at that and I'm like, oh, that's another layer I can add into my exercises. That's awesome, right? Like it's much like
Yeah,
when breathing, right? Like we start to just shift our focus towards the importance of breathing, and then you start to layer in different breathing techniques and stuff. This is another layer, right? So,
exactly.
mhm.
Exactly. And it's so fair. We don't need, I mean, we love our toys, right? We love our ooh and our balls and our all sorts of doodads that we use, our foot corrector and all of that. But you don't need any extra equipment. And right
Yeah.
now, because it's hard for people to get to spaces with equipment, or they're being very mindful of resources or have limited resources, all they have to do is start moving their eyes. I tell people, because I really believe there's a nature deficit as well. I see this in the people I serve.
Okay.
They're just stuck, kind of have that building syndrome, and sometimes it can become sick building syndrome, which is a whole nother topic.
Yeah, right.
But just that stuck inside syndrome. And so I always say, get out and walk. You don't have to do a 30-minute walk. That would be wonderful, but maybe it's a 5-minute walk. And I would
Mhm.
love for you to take your eyes and trace the outline of the leaves. Well, then when the leaves fall off, I'd love for you to trace the outline of the branches. I'd love for you to look at the
Wow.
different that show up. So we make it
Yes.
a whole restorative exercise. And I know my day today is pretty packed. I already did my cardio, but I still want to get outside. So I promised Snoopy even a 10-minute walk.
Mhm.
And we're gonna go, and he helps me slow down because he stops to sniff everything, and I help him slow down because I stop to look at things from all dimensions. And it's part of
Yes.
my care, you know?
Yeah, yeah. Interesting. So then, okay, so then we've just covered our eyes.
Yeah.
Can we speak to breath and how you integrate that into your work?
Oh my goodness. Yes. How much time do we have?
Yeah, I know.
No. Breath. I love the idea of breath, especially we as movement, Pilates, fitness professionals. We're very focused on helping people access their breath. I might look at it very differently than most because I look at reflexes tied to breath. So let me just pause here and I've mentioned reflexes a few times,
Yes,
and let
let's
me
write it down.
look at
Yeah.
basics. So babies come into the world and they're not moving with motor control and coordination. They're moving with brainstem level reflexes, and that's how they explore. So they're doing things looking from one side to the other. The hand is being followed by the head, for example.
Yes.
So we should integrate those in the first 2 or 3 years of our life, right? Most of the primal reflexes. We do have lifelong reflexes that are different than that, but we should be integrating those reflexes. But
Mhm.
life happens. In today's world, I have a lot of concern about the babies being trapped in the doodads where they can't really walk freely. They're not being given tummy time because the parents are being scared to put them on tummy, which they need that to develop naturally. And so some of our kids today are not integrating the reflexes as they should. They're going to be our future clients in, 14, 15, 18, 20 years.
Right.
So they'll
Yeah.
keep us busy.
Yeah.
But the concern is too, I mean, they're also stuck on screens. So
Right.
add to that, they're maybe not integrating those reflexes and the screen time, or you have adults that integrated their reflexes and they then have life stressors. They're in a car accident, they have a disease process they're dealing with, they have a trauma. And so they need to revisit those reflexes that were first integrated. And back to your question about breath, some of the most important reflexes are tied to breath.
Okay.
If someone's having a difficult time with breath, I will have them do some reflex moves and then the breath can come online more naturally, more organically. If someone's having a difficult time accessing trunk rotation, there's
Yes.
certain reflex movements I'll have them do that are involved with sucking and swallowing that will help them access more rotation in their spine.
Interesting.
So there's just, I mean, I never can get bored. There's always something that's kind of a hidden. I feel like a detective going in
Yes.
there. What can I go in there and say, what's really underlying here that could help
Mm.
them access freedom of movement, the ability to feel functional and empowered from a place of ease. And
Right.
so breath is really important too right now, Martin, because of all the mask wearing. We're wearing masks at work, and it's so important that we do that. But it's really important that we give ourselves some integration work after taking the mask off because I have so many people, professionals that I serve, as well as the clients I serve, their jaws are locking down, they're
Hmm.
not breathing properly, they're
Right.
disrupting their breath patterns.
Right.
And so for them, we need to do some quick little ditties when they take their mask off to help them release the jaw, reconnect to their breath. And it's just so simple. It's
Right.
As I always say, everything is right there inside of us. We just need a little guidance to turn on those connections, become more integrated, and then able to move forward with ease.
For sure. So then, so where did you learn this? Like, what are the resources to get this stuff? I mean, 'cause obviously there's curiosity there. No question, there's a
Yeah.
curiosity that sent you on that path. But where would the average person access resources to learn about these things? Because I could use it with my client today and be like, well, where'd you get that? Like, I just talked to someone today. Like,
Yes.
where do we get it?
Yeah. I'm just having a harder time hearing you. I don't know if there's something going on there, but just FYI, I heard
Okay.
your question, I think, was about where would people access this? Well,
Yes.
that's such a great question. And for years, I felt like there was nowhere for people to access it. So I actually have put together tons of free content. So not to plug my work, but I know it's one
Plug
of the few
away.
places that
Yeah.
I know it's one of the few places people can find it. So every Wednesday I share what I call Work In Wednesday because one of my
Amazing.
taglines is why work out when you can work in? Because working out changes bodies, but working in transforms lives. And I get to see that.
Yes.
I get to be a witness to that transformation, which just thrills me and excites me. But so I have tons of free content. You can sign up for my Inner Resources free gift, which is a 3 video series to get you started. And
Okay.
my intention would be to have you learn those share them with your clients, and then have your client say, hey, before you start your session, I'm going to have you do that PACE preparation. PACE is just a simple 4-step sequence, and just ask them to do it every time. Pre-COVID, people would come in and do it at the start before the session started,
Yeah.
and then do it. But now, since they're waiting in their car until the prior person leaves, we have to do it when they start, which is okay. It's great. We still get it in.
Yes.
And so there's lots of tools for the professional that's looking for the tools to support themselves and get these tools to help them first so that they can better help others and then pass to their clients. That's what my Inner Resources workshop is, that completes tonight, and I'll do another one in early 2021. And that's just a quick 4-hour online offering that we do with self-care for the practitioner, and then tons of empowerment tools for them to use for themselves, their families, and their clients.
Yes.
But I also think maybe part of your question was like, how does someone study this stuff?
Yep.
I do have a 2-day course offered that's called Innate Connections for the Pilates or rehab or personal training professional that wants to learn how to put the work into their movement modality of choice. So that's an option. But the way I got started, I love to share this story because it started with me being a failure.
Okay.
Yeah, and I'm pausing there because I like to let myself really say that and feel that, because I failed at trying to meditate. And this really bothered me because in 2001, I opened my holistic multidisciplinary clinic. I was super excited. I had an hour to spend with everyone. And that's why I left the traditional rehab world, is because I was getting 20, 30 minutes. Then I'd have to pass someone off to a tech. And that's not the kind of treatment I would want. I want to be able to complete the full circle and provide holistic treatment. So 2001, I opened my setting. I had an hour again with everyone. Life was grand. And around 2003, 2005, I started to see that people were distracted. They were texting all the time. They were always on their cell phones. So I would have to take about 20 minutes to get people into their body and be ready for the session. I'm like, whoa, we got to do some prep work here, right? And so that's when I started studying brain gym, GYM, like gymnasium, because I knew I needed to help these people reconnect. And I also, around that time, was feeling immense stress trying to run a business, working with fertility challenges at that time, studying a lot. I was in manual therapy school and had a lot going on. So I was feeling stressed, and I thought, well, I'm gonna meditate. Well, I would sit down and I would meditate, and I would either fall asleep or I would drive myself crazy with the collisions in my head, because so many thoughts would bounce into each other like racquetballs. And so I decided that, well, maybe I should do what I do with my clients and meet them where they're at. So I said, okay, you don't do well with a static or stationary meditation. You love movement. Movement's been your way to work through emotions your whole life. So I started to take the brain gym tools that I was studying, and I created a moving meditation, which is actually a synergy of the brain gym. It's a synergy of the reflex integration. It's a synergy of Pilates. It's a synergy of cranial sacral work that I do. It's just everything that can help us move and find that space of peace and calm and integration. And now I can actually sit in meditation, quiet, stationary meditation, and I love it. But I usually have to lead in by doing some of the balancing of the right and left side of my brain, body, and nervous system.
Right. Wow. I can think of Marcia Polis, who does like the cranial sacral work. Are you familiar with Marcia Polis?
I am not. I didn't hear that fully. Marcia?
Yes, Polis. She does like the cranial sacral work and some other work along those lines too. So it'd be fascinating to just hear. I wish she was here. She'd be asking you so many questions in the chat section right now. Yeah. How's the volume? Is it okay, or?
It's still a little dampened, and it was perfect before. I don't know what happened. Could be something in my end, certainly.
Okay. We'll keep working with it.
Yeah. I might just need to ask you to repeat a question or something, which is fine. Can you hear me okay?
Perfectly. Yeah.
Okay.
How did you find Pilates?
Oh, great question. Oh, I love this question. So I had a very brief introduction as a dancer. I had an introduction to some Pilates mat, and I thought, yeah, that's great. That kind of kicks my butt, and I need it. And then I took a year between undergrad and grad school, and I moved to Washington, D.C. because I wanted to live in a big city that had more diversity. And I wasn't feeling the New York, LA vibe. So I thought, I'll move to Washington, D.C. And partly I had family like an hour away. So that felt kind of nice and quieted my mom's concerns. And so I moved out there and I was working 3 jobs to afford to live in that city. Um, and that was crazy. Talk about adrenal depletion. I was the perfect example then. And one of my jobs was working at National Rehab Hospital, which was like my coveted to work at National Rehab Hospital, just felt like such an incredible opportunity to be around some of the best therapists and to learn from some of the best. And I did.
Okay.
But some of my most important learning didn't come from the therapist. It came from this one particular patient. And this patient was bicoastal. She lived on the West Coast and the East Coast. And so um, what happened is this beautiful facility I worked at had the Pilates reformer and a
Okay.
Cadillac. And
Nice.
none of the therapists knew how to use it.
Yeah.
None of them, because the one therapist that was trained in Pilates had moved on to a different job. And so I had this woman would come in, and because she had been working with that therapist before she left, she was still allowed to come in and use like gym time and use the Pilates apparatus because she had done a lot of training with practitioners on the West Coast. So
Okay.
during my lunch break, I would sit there and watch her and ask her questions and take notes and just really kind of soak it up. And one of my mentors would say to me, "You're like a sponge. You're just here to learn, aren't you?" And I'm like, "Oh, yeah." Isn't that what
Yes.
life's about? Learning, right?
Absolutely. Yeah.
So I would be in that space and just kind of see the apparatus and just be fascinated. And then I went to graduate school, and as soon as I was done, I started studying Pilates and knew that I had to study and learn the apparatus and continue to study. And soon after, got the apparatus and really just brought that into the whole rehab world. And I've never stopped. It's such an incredible, incredible tool. I'm so grateful.
I often say that Pilates is the missing link for people's training, their exercise, their performance, their corrective exercise, whatever it is, that is that missing link, that other little piece in there.
Yes.
Yeah.
Yes. I say that so often too, because perhaps you run up against this too, but people will say, "Oh, I tried Pilates and it didn't work for me because of XYZ injury." And I'll say, there's all different types of Pilates, and there's a whole subcategory or category of Pilates that's all about rehab. So perhaps you just didn't have the right approach yet with the right use of the apparatus, or even without apparatus. You can approach rehab-based Pilates without apparatus too. So
Right.
yes, it's such an amazing, amazing tool, and it really is that missing piece for so many people. And I'm so grateful that we have it.
Oh, absolutely. And what you just said there too also speaks to every client has their teacher, so to speak,
Yes.
and so there I've bumped into someone in Starbucks a while ago and they're saying, "Oh, I did Pilates, but it hurt my back." I was like, "It's supposed to help your back. How did it hurt?"
Right. Right. Find
Like
a new teacher,
find
right?
a new teacher, right? Like,
Yes.
and that's not to say that teacher was bad, but like obviously that was not your teacher. So clearly,
Right.
keep hunting because they're out there. Yeah, so it's interesting.
Exactly.
Can you talk a little bit more about the brain gym? Like I heard you mention that before. I was like, okay, what exactly is that?
Yes. So Brain Gym was originally started for children with learning differences or learning challenges.
Okay.
And so it's a whole body of work that Paul Dennison and his wife started. It's a beautiful, incredible body of work. And it really helps integrate the right and left side of the brain and the body. And here's the beautiful thing, it's all movement based. It's all movement based. Like the other day, my daughter was trying to pull one over on me. We have low, um, a very low threshold or allowance for screen time
Okay.
because we don't really believe in screens, except now she's had to do some because of the change in schooling and so forth. And so she tried to tell me she saw something that said, improve your brain skills with just 10 minutes on this game a day. And I was like, oh no, honey, you're talking to a brain gym practitioner. Let me tell you what that is. That's called marketing. So then she got a whole lecture about marketing. Then she got a whole lecture about what being on screens does to our brain and why movement and being in nature is what our brain needs.
Mm,
So taking it back to Brain Gym, though, it's beautiful because it's not screen based. It's all about helping people find those missing areas. So Brain Gym and reflex integration and the type of work I do, what we're doing is we're myelinating around areas that were damaged, we're remyelinating, and or we're helping to make connections that were never made.
never made.
Again,
Yes.
most
Yeah.
of us integrated in the first few years of our lives and had our bodies in a place where we could integrate right and left side of the brain. But some of us, I mean, I know there's some reflexes in myself that I think, ooh, I didn't probably integrate these early in life. So I've done lots of compensations.
Okay.
I've done lots of overcompensating to try and make up for that. And now, as an adult accessing the work with the Brain Gym, I am really feeling like things just happen from a place of ease. It's not so hard. I don't have to work so hard anymore.
Okay.
And that's Brain Gym is a beautiful, beautiful modality for that. And Brain Gym is used a lot with children. Like a lot of my friends that are teachers and OTs and PTs with pediatrics,
Hmm.
they're very familiar with it. I'm one of the few people that's taking the Brain Gym model and bringing it to adults. And what I say to the adults is, look, yes, Brain Gym was first developed to help us with learning, but we as adults are trying to learn how to get through every day, be at
Yes.
our best. And now
Yes.
we're trying to learn how to get through these days with uncertainty, with a shift in our work, with concern or caring for family members. So it's totally different. And so our bodies have to relearn every day how to deal with stress.
Yeah, absolutely. So then, Kelly, who is like your ideal client? Like who is coming in to work with you at this point?
Yeah, I knew you were going to ask that. And so I was reflecting on that a bit. And I think it's maybe two or three pronged. The ideal client is the person that's really interested in whole person, whole body. So I'm not
Yes.
only going to work with them on their physical movements or their um, rehab needs, we're going to look at emotional and even spiritual if they want to go there. So, for example, I had a woman come in yesterday and I said, you've told me what's going on with your spine today. How's your brain and your heart space? So I'll say,
Great
what's the
question.
update with your brain, body, and heart space? So a client that's open to that, but sometimes people don't know that they need that.
Hmm.
So I gently meet them where they are and we bring that in. We bring that in a little bit when they're ready, just a little sprinkle at a time.
Yes.
And then the other person I think too is I get a lot of the people that have tried everything else and it didn't work. And so I get a lot
Yes.
of people that are kind of fed up. They're maybe skeptical because they've tried everything else. And I like to have challenging situations to
Yes.
connect. Well, for example, the client who says, oh, my balance has really shifted, it's changed. And my doctor just says it's part of the aging process. And I'm like, I don't buy that. I've worked with
Mm,
you for this long. This is not part of your aging process, I don't think, at least. So then we start to explore some reflexes that were tripped up. And what do you know? We find that place of ease again. And
interesting.
so that's the thing is I really attract, I think, people that have multifaceted needs and are willing to be holistic about it. They're not just looking for a workout. If they're looking for, a super hard workout, we can get there once their body's organized and aligned. But if
Mhm.
that's all they're about, I'm going to help them find another practitioner because I won't be the best one for them.
Right, right. So then would someone come to you wanting that and you look at their body like we need to work on this, 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 and this first, and then we go, or can you just like throw them into it?
If I understand your question, someone coming in needing some integration, but how would I start them? Is that what you're asking?
How would you start them? Yes, exactly.
So I always do an assessment, which has a biomechanical component, but it also has a component looking at three dimensions, the first three dimensions of brain-body connection, which are laterality, centering, and focus. So
Okay.
laterality is the right and left side communicating.
Hmm.
Centering is the top bottom part of the body connected of the brain and the body. And focus. Are they able to focus or are they hyper focused? And I see a lot of hyper focus, especially these days. So that's sort of part of my cognitive assessment, if you will.
Okay. Yes.
And then I'm also gathering a lot of details. What's your functional life like? What is your greatest challenge? And it's not just physical, but sort of emotional. And certainly I'm always referring out to mental health providers. I know my scope. I have a lot of mental health providers that I'm referring out to, but a lot of mental health providers refer to me because they want the movement part, the integration part to go with their talk therapy or their EMDR and so
Yes.
forth. So I definitely am starting there. And then we start to move, but we move somewhat playfully. Like the first
Mhm.
time everyone comes in, I give them PACE, which is part of that video sequence. It stands for positive, active, clear, and energized. These are readiness nervous system tools. Before we start the session, we do that. Then I might
Yes.
have them on the Pilates reformer or trap table. And while I'm changing springs, I'm having them do a cross crawl, which is a contralateral movement, super simple,
Okay.
and it integrates the brain and body. And I'm having them do that because I don't want to waste any time. I'm changing springs, I'm moving stuff around, and it's not a spectator sport to watch me change springs. So they're going to be there doing their work, and
Nice.
then we might move to some movement without any apparatus that is going to have, again, those brain body connections. There's one that I call the bow and arrow that
Okay.
looks like we're doing a bow and arrow movement, but it's actually the asymmetrical tonic neck reflex that we're integrating. And it's a pause reflex. So it brings them to the here and now. And I might pull that out if someone is like, I have this one gentleman that he's amazing.
Yes.
He's in his eighth decade and
Okay.
he's still working as an attorney, but he's always, you can tell he's got a lot going through his brain. And you
Yes.
can tell he's thinking about what he has to do when he leaves here. So I'll make him stop and do that pause reflex because it puts him in the here and now. And then when I move him to the chair, he's able to be more present with the movement, with his body, with his breath. And
Yes.
so that's just an example. And then we might end on the table with some cranial sacral. So that's just kind of an example of how a session would unfold.
Right. Can you talk more about that pause reflex? Because
Ooh, yeah, I'd love to.
I'm sure that even the people who are watching here, like whether, whatever clients we're working with, people, it's just tough to keep them in the room, right? Like,
Yes,
yeah.
yes, absolutely. And I think that makes our job so challenging, but it's especially challenged right now because we're trying to get
Yes.
people into their bodies and they're
Right.
checking out, they're somewhere else.
Mhm.
Um, so the pause reflex actually is the asymmetrical tonic neck reflex, or the ATNR. And I tell clients it's the bow and arrow, and we can do it very simply. I mean, let me see if I can, I don't know, I know this isn't always going to be visual, but if you bend one arm, I don't know if you can see me, but if
Yes.
you bend one arm and then you bend that knee, so if you're standing, you pop that heel,
Okay.
and then you take the other arm out straight, and you have that arm out straight, and you're standing on that leg so it's straight. So if you picture right elbow bent, palm turned
Yes.
away, right heel popped, so therefore right knee is bent.
Yes.
Left arm is out straight,
Yep.
left leg, you're just standing on it straight. Then here's the key. Turn to look at that straight arm. Hold and breathe. Just hold and breathe. Do
Yes.
it at least 3 times on each side. And there's a whole visual component we bring in later, but just starting with that, that's the pause reflex. And I
Yes.
did it before we came on here together today because it was that morning where I got up really early, did my practice, did my intention setting, helped my daughter, was responding to emails and so forth, and then preparing for this. And I said, hold on. I did my balance work, which was my moving meditation. But then I said, you know what? I want to do the pause reflex because I really want to be in this moment. Here's a
Yes.
Canadian friend. We love our Canadian friends here. It's
Yes.
easy to get to all and can't wait till we can come back to visit that area. But here's a Canadian friend that I get to have the joy of connecting with today. So let me just
Hmm.
pause and be in that space of being in that moment. And it actually helps to bring in those alpha waves that bring us to the here and now. And
Yes.
so that's the simplest way to access the pause reflex. But I have ways that I sprinkle it into mat work. There are things I do on the reformer and the track table that bring that movement sequence in so that you can actually integrate it right there in that Pilates repertoire.
Amazing. I feel like so much calmer just hearing you talk about what we need to do. So that's
What's that?
I feel like calmer just talking about what we should be doing. Like yeah,
Oh, I'm so glad to hear that. And that's
yeah,
the thing. It's all right there inside of you. And I've
it
shared that bow
is.
and
Yeah.
arrow or pause reflex. If you go back through the work in Wednesdays, and
Hmm.
one of my intentions when I have a little time here at the end of the year is to better organize my YouTube channel because there's a few videos that show the pause reflex, both on the Pilates apparatus and with no apparatus. And so when it's better organized, you can find it. But they're certainly on the work in Wednesdays.
Okay, I'll repost it. Yeah, because I think that would be cool
I
just to
can help you
connect.
find it.
Yeah, please,
Yeah,
or send it to me afterwards, and I'll repost it again.
sure.
Um,
Absolutely.
yeah, I think I'm so big on just being present in our workouts, and that is part of my background in social work as well, right? In counseling. Being in the here and now is so key, right? We feel like we just want to get a quick solution, and we want to just get a quick fix, and let's just tick that box of this workout. Let's get through this hour. So if we can maximize our time and our intentionality in this moment that we're in, we can get so
Right.
much more out of it, right? So
Absolutely. And I think being in the here and now is just we're up against so many challenges, even pre-COVID, all the distractions, and so
yes,
it's really hard. And I've listened and learned that your background is in social work, and I think what a gift it is to your clients because you're really able to address that whole person. And
mm,
so there's just so many quick, easy little tools we can use to help our clients. Again, maybe it's at the beginning of a session or in the middle and at the end. And like in tonight's inner resources workshop, I'm teaching tools for practitioners to use when they finish their day before they go into their family. And I've heard you talk about the gentleman who had the great insight of saying, when I turn that handle on that door, and I'm sorry, I've forgotten his name, but when you turn the handle on the door, that family on the other side of that door, they deserve the best of you. And so I have little
yes,
rituals I do at the end of my day because the creative sparks are always still in there. And
yes,
I just kind of do my movement rituals that are very gentle and grounding. And I say, guess what, creative sparks? You'll be there later. Now's my time to go spark creative joy with my family. I have a super creative 10-year-old. So, it's about setting those boundaries. And I have those very simple tools that we do for that.
amazing. We don't have that much time left. It really does fly by. But
Does.
I'd love to hear your definition of mindfulness.
Ooh. So, my definition of mindfulness. Well, I think about this a lot, and I'm sure it's evolving, and I'm always learning and adding to it. But when you pause and look at the word mindfulness, there's the word full in there.
Okay.
And our minds are full of a lot of crap.
Yeah.
And we need to kind of cleanse that out and look at mindfulness can be the self talk. So, as an OT, we work with something called ADLs, activities of daily living. And does someone have the strength and range of motion to be able to take their shower and navigate their world and care for their children, pick up the baby, so forth? I have changed that from activities of daily living to activities of daily loving because we need to bring the mindfulness
Mm,
in. A
okay.
lot of times I hear people talk to themselves in a way they would never talk to a friend, not even
Right.
an acquaintance. They would never talk to that way. And I'm like, hold on, cancel, delete that. Did you just hear what you said? And so
Mm,
taking a moment to be mindful of what we let enter our mind and then making sure we're clear and organized before we share our mind with others, and those others being family and community and colleagues and clients. So mindfulness for me is really about being mindful or being intentional about what we put in our mind, what we organize our mind with, and what we put back out there. So, as crazy as it sounds, sometimes I make washing the dishes a mindfulness exercise. I feel the sensation of the bubbles. I smell the really nice essential oil um, soap that I'm using, and I look out the window at nature and I notice that the deer have come through or what's going on. And so that's just a really simple mindfulness practice. And I think it's always evolving. So I know that was a long-winded answer, and I'm sorry for that, but I think it's being
no,
being aware of what's in our mind, how we organize it and relate to it, and what we share with ourselves and others. So being present is a huge part of that.
yes. I like how you organize that, organizing it and then putting it back out there. That is so key. I don't think we didn't spend enough time with that
Right. It's like KonMari organizing for your brain,
for your brain.
and
Yes.
it's so
Yeah.
simple.
Yeah.
Just like, the KonMari method. It's very simple. And I'm certainly not, I mean, I do not have the KonMari closet or anything. There's lots of messes. So my brain is better organized than my house. Let me put it that way.
Yeah. Yeah. Well, I mean, that's why I use journaling for that too, because I feel like I just can't organize it in my head. I need to like take it out,
Yeah.
organize it, and put it back in. I can't just clean a room in the messy room, right?
Exactly. I love journaling. I do a lot of mind mapping. I
Hmm.
have huge art tablets that I use to do my creative process on and use mind mapping. And it's always fun because I'm not an artist, and yet I get to use the big art pad and the colored pens. And so I feel like it really it indulges my creative side. So
Yes. Yeah.
I get it. We're always trying to organize those thoughts. And so when I send you a little bit of info, I would just invite you to do the pace before you do your journaling. I think you'll get even more out of it.
Okay. Yeah. Yeah. Oh, absolutely. It's like going on vacation. You spend 3 days unplugging, you know, on your
Yes,
vacation, right? Like, or you could be
right.
mindful of getting into that. So, that is so helpful. Thank you so much.
My pleasure.
Yeah.
It's truly a pleasure, and I love sharing this, and I love what you're doing. Thank you for what you're doing.
My pleasure. Afterwards, I'll reach out to you. I want to just put all those different resources that you have for our community.
Thank you.
And just one last thing too. When Iffy was on yesterday, she has a great marketing background that she brings to Pilates. And in the same way you're saying, I have like my counseling background that I bring to Pilates. All the mindfulness work and the brain gym work and the OT and things that you bring to Pilates, I love the add-ons that people in our community have that they bring to Pilates. And that is what makes us all unique, like fingerprints. Like all of us have that little special something that we add to it. So thank you for what you add.
Oh, thank you. Thank you for recognizing that. And I love noticing that and recognizing that in others as well. I have a friend and colleague whose dad was a builder, and so she's great at building and helping people navigate and look at their spaces for safety as an OT, and really looking at home renovation and remodeling from the rehab perspective. And so I think, wow, her upbringing, moving to all these houses that they constantly turned from, the diamond in the rough, making it the diamond in the rough. She now has this great eye and talent for that. And so I
Right.
love learning the extra background that people bring, and thank you for bringing people forth that can share their talent so we can find them.
Yes, my pleasure. All right. Well, thanks again for today. I'm going to sign you off, and I really appreciate all you're doing, Kelly. Thanks so much.
Thank you so much. Take
All
care.
right.